Happy Friday, everyone. For those that may be joining the first time with us, I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. Thanks for joining us today. We're going to turn it over first, I think, to Amy to give us some state updates.
Yeah, before I turn it over to the state update, I wanted to just let everybody know now that we have our 100th member of the Iowa House who was elected in a special election a couple of weeks ago. He was sworn in this week. He got his committee assignments this week. So we have finalized our legislative guide that we are calling Who Represents You. A reminder that includes federal information, and boy, what a year it was to include that information. And so it is a little bit newer this year. It is available currently on our website at that link there. We will be mailing printed copies out to those that receive this by mail. And so just keep an eye out for that, but you can see this now online. So I wanted to quickly go over some state updates because we really wanted to concentrate on what all is going on at the federal level. There's been some big announcements this week that I know has people really concerned and questioning how that's going to impact us at the state in policymaking, as well as you back home in your schools, and what those implications are. So we'll get started really fast. This is coming up on funnel week. We have our second and last deadline for the year, and that is on next Friday, April 4th. So bills will have to get out of either the House or the Senate, one chamber, and then out of committee of the other. So really all that's left after this is debating on the floors and sending bills to the governor. Just as a side note, session's supposed to end on May 2nd. You know, it sometimes does, sometimes doesn't. We don't have budget targets yet, so we don't know what the budgets are going to look like. But just heard yesterday from the House committee chair, HHS committee chair, that the Senate Health and Human Services Committee has only sent one bill between the funnels to the House Health and Human Services Committee. So they're planning on having one subcommittee and one meeting to do one bill this next week. I don't remember what the bill was. I'm going to have to look that up, but I found I don't think I've ever heard that before. So House doesn't have a lot to do. The Senate has a lot to do. Quick update on bills. I know people have questions, but there is a subcommittee meeting on House File 509 on Tuesday. That would be April 1st. Hopefully there's no April Fools with that. But that adds applied behavior analysis, or ABA, treatment to the Children's Health Insurance Program. That's Hawkeye. We have the comprehensive transition program, so like the REACH program at the University of Iowa, that has passed out of a subcommittee this week. So it's still in appropriations committee. So it is funnel proof. Deadlines don't apply to bills that involve spending. But the big news this week was that the House passed the Health and Wellness Plan work requirement bill. Reminder, it doesn't affect regular Medicaid or waivers. There's exemptions for people with disabilities, or people who are considered medically frail, some caregivers. That bill is now, it passed the Senate, it passed the House this week, and it's back in the Senate with an amendment. That amendment adds the state, the House had a request for a study to look at other state Medicaid for employed persons with disabilities programs, the MEPD program. That is in the new amendment that goes over to the Senate. The Senate's going to accept it. But that is an important inclusion, because we know the Work Without Worry bill is really probably not going to move this year. I would say I'm 99% sure of that. And so this is the legislative leaders' way of trying to keep that issue moving forward by having the state look at what other states have done in that area to expand access to work, and help people get out of poverty and work to their full extent. And so we'll be watching that closely over the summer to see how that moves forward. And then you can see there's some other bills that are already safe from the legislative funnel. All of this will be in my written report this week. So if you didn't catch all of this, it'll be out in what I email out on Monday. So I'm going to turn it over. Well, I guess I'm talking about this slide. I want to move into federal updates. Big news this week was the Department of Education elimination. The president has signed an executive order ending the Department of Education. He said that there was no accountability, that it was only created in 1979 and since then has failed to improve student scores. I will say he wants to end the Department of Education and return responsibilities to the states. The funding that goes to the states would end any kind of diversity, equity, and inclusion requirements, anything dealing with transgender, gender identity. You would not be able to include in your educational programs in order to get federal funding. Legally, he can't do this. He can't just eliminate a department that was established by Congress. Congress has to do something. But as we've seen with this administration, he pushes his limits, and it'll be up to the courts to make decisions on whether he can proceed, but he can reorganize and he can cut staff. And that is what he's doing. He's immediately cut half of its workforce in the Department of Education. And so I have links to this. I will post this PowerPoint slides on our website immediately after this meeting. So you can go in and read some of this information. But I pulled out a section from the National Association of Centers with Developmental Councils of Developmental Disabilities. So the Iowa DD Council's national organization. Said that this executive order threatens to undo years of progress, leaving students with disabilities without necessary services, protections, and opportunities to thrive. So what this means to special education, well, we don't know, but we know losing staff means the department will have less oversight, will have less capacity to help states. We already know we're having a lot of changes at our state level. So who's going to be making sure we're still doing what we need to do for special education? We don't know the answer to that. But these are some questions that you might ask your Congress people or others when you're talking about this. This is what NACDD has asked the federal government to clarify. So will there be adequate mechanisms to make sure schools are complying with Section 504 and the Individuals with Disabilities in Education Act, or IDEA? How will students be prepared for life after school? Because part of the Department of Education is vocational rehabilitation. Will there be any services to support students with disabilities and successfully move them into adult life? How will the federal government continue to support and guide students and families and school districts with their individual education plans, their 504 plans? How are we going to make sure they're properly monitored? I think those are all questions that have to be answered before you move forward with ending a department like this. So those are some of the questions that they have advised people to be asking and want to know from the administration. We don't have answers right now. We're going to have to watch how this moves forward and what that really means to our education system here in the state. It also means we'll have to watch our new federal funding appropriations subcommittee here at the state level, because they will be looking at things like block grants to states. And if that's how they get money to states when the department no longer exists at the federal level, then that's going to go through that committee. So we're going to have to watch all of that very closely. I'm going to turn it over to I think Brooke for discussions on this new announcement this week.
So this really actually came as a shock. I think there had been rumors about the Department of Education, but even for the people that are within the know at DC, they were not prepared for make America healthy again, and all of the cuts to the Health and Human Services Department. The one that is most concerning, I think, for us that are working on disability advocacy is the eliminating of the Division of Administration on Community Living. And within that ACL lies the DD councils, the University Centers for Excellence on Developmental Disabilities, Disability Rights Iowa, all of the Centers for Independent Living, some of the brain injury programs, a lot of funding for nutrition. All of that is within the Administration on Community Living. Excuse me, it takes those programs, or what the press release says is it's going to administer those programs across 3 other agencies. And why this is kind of perplexing or confusing is that the Administration on Community Living has only been around for about 13 years. So when you look at the scheme of administration and bureaucracies in DC, this one has not been there as long as some of the other divisions and departments. And at the time, ACL was created out of programs that were about aging and a couple of programs about disability. And so it was streamlining those programs to make them, to get rid of the red tape, to get rid of the bureaucracy, to coordinate services better for people with disabilities and people as they age. And now that's just breaking up all of that work that was done, which doesn't really relate or coincide with the whole concept of Dodge, because now it's splitting those up again among 3 different other agencies. It's the Children Administration and Children and Families. The weird one is the Secretary of Department of Programming and Evaluation, and then the Centers for Medicaid and Medicare. We do not have any information yet about where all of our programs will lie. Most likely it will be for the Centers for Medicare and Medicaid. But this really does have us questioning, what happens to all of the work that we've done with community living. Since this is 2012, with the development of ACL, institutionalization has truly gone down because of some of the work of all of these programs that I mentioned. Community living is not just a choice anymore; it's a necessity for millions of people who rely on services. And so these questions here that we've got posted on the slide are the same thing as Amy said about the Department of Education. These are questions that you can be asking Congress at the federal level on what they're going to do to ensure that we're going to continue to support community living, make sure that we're listening to the voices of people with disabilities and older Americans as we're planning our services. So do take a look at that. We do actually have these 4 points or questions came from our national association, which is the National Association of Councils on Developmental Disabilities. We did actually post their statement to Facebook. If you follow us on Facebook, you can check that out and check out their concerns about this. But we do have a lot of questions about what this means for community living, and there's still really a lot unknown about where all of these programs will lie. In that press release that Amy's got linked there, and we could probably put that in the chat too so you can see it. Kennedy does refer to the crucial programs, essential crucial programs under ACL that will be distributed between these 3 organizations, but they don't define what those crucial essential programs are and what that means on who's essential and who's not. So more to come on this, but this is something else with all the other stuff we're asking people to advocate for This is also something we'd like you to mention about how important administration of community living is and why we need it. And so take a look at those questions that we post and talk to your legislators about those. And I think, am I turning it over to Carlin or Amy?
Carlin.
Yeah, me, but my internet's unstable, so if I get frozen, you guys let me know. So I apologize. So for federal update on Medicaid, if you were on our call a couple weeks ago, we don't have much more of an update. So, or nothing quite new has happened in this part of what's going on at the federal level. So what we added here were some statistics and facts about what could impact Iowa, how many people could be impacted in Iowa on the cuts that are being proposed. So you can see that, and we didn't talk about SNAP last time, so this gives us some more data on food assistance and those who would be impacted by cuts to food assistance. So 41 million Americans are on SNAP, so that includes 130,000 Iowa families. There was a SNAP bill that passed the House this week that does not cut the number of people on SNAP, but it makes some changes to what kinds of food are available to people who are on SNAP. In case you were hearing about Iowa or state legislation on SNAP. 72 million Americans rely on Medicaid, and that's 700,000 kind of rounded up. If you look at the Medicaid dashboard, it's usually around 700,000 Iowans and 72,000 Iowans with disabilities. And that's 60% of children, or 60% of people who are on Medicaid are children. 60% of, oh no, sorry about that, 60% of children in the US. But it is the highest majority of the Medicaid population is children. And the cut that we keep hearing about is 880 million. This is that was in the House continuing reserve, or their resolution that they're negotiating to get worked into the next budget. However, what we have heard is that most people, what we're hearing from the Senate side is most people think that's too much, and that it might not be that. So we still don't know. But that would equate to $713 million a year cut to Iowa. And some have suggested that could go up to $1 billion, which is a lot when your budget is $6 billion. So that could be a huge cut. Right now, 17% of the average increase in state Medicaid spending is needed to offset cuts. So there needs to be an increase. And so we're looking at a decrease. So that means that either services have to be cut or fewer people will be able to be on Medicaid or get services. And we know, because we know that cannot make up for whatever waste, fraud, and abuse has also been suggested as the needed for those cuts. So what does this mean for Iowa? Well, as you know, we still don't know. We just know that any cuts are not going to be good, and the bigger they sound, the worse it's going to be. So we need to keep talking about what Medicaid funds now and how we're still not providing all the services that we could be, especially when you hear about people on waiting lists and waiver waiting lists. But in addition to how it affects individuals on Medicaid, it also will have an effect on providers. And that could include hospitals, entire hospitals, especially in rural areas who rely on Medicaid because they have Medicaid reimbursement, because we have so many people in Iowa, especially rural Iowa, who are Medicaid members. So it's the effect could be far and wide, and not just on individuals, people who are insured. And it could raise the cost for everybody's insurance if Medicaid goes, if fewer people are on Medicaid. I heard a really good economic analysis of that yesterday, which it would be hard for me to repeat because I'm not good at math or economics. But it was the first time that I had heard the kind of deep impact it could have on anyone who has insurance, that all of our rates could go up. So we can still advocate for this, and we need to talk to our members of Congress about it to protect Medicaid funding, protect the budget that we currently have, if nothing, to not make any costs, and look at other ways of looking at waste, fraud, and abuse. So if you're wondering what to do, it's now your advocacy is more important than ever for so many reasons. The ones that we have talked about today, you may have also heard that there have been some changes suggested to policies and rules around how the ADA is implemented by businesses. The Justice Department has gone in and looked at, some of it was kind of old rules and policies that may not apply today, but they've gone in and looked at the ADA and how it's affecting business. And they've gotten rid of a few policies, or have recommended getting rid of a few. So, it seems like every part of our, ecosystem that works for programs and services for people with disabilities is under attack. And I put that question in here so that we think about asking our members of Congress that specific question. And it's, why are programs or services for people with disabilities under attack? And you notice that it's not saying why are people under attack, because I think that gets too personal at this point. But we can certainly see how programs and services are going to are already taking a hit. And we've had stories already. I've heard about people who have needed to get information from the Department about claims of students' rights being taken away at the state level, and there's nobody to answer the phone right now. So those things are already happening. So you can obviously call, write, email, visit your members of Congress. Keep it up. They know they're getting lots of calls, and we need to keep calling and emailing and visit if you can. And if you've already done it, something new comes up every day. Yesterday, it was everything about the Department of Health and Human Services, and it's concerning how much is being thrown at us. So throw it back at them. Let them know how you're feeling, and ask questions. Usually we, talk about, with your advocacy, talking about kind of specific bills and offering solutions. This time, I think we need to ask a lot of questions while you're doing the same thing. Specifically, why are these programs and services under attack? It can't be all waste, fraud, and abuse. Do we want people who, we've made such an effort to focus on community living? Do we really want people to move back into institutions if they can't be supported by community living services? So be specific, and because that helps them know how it hits you personally. And same with your state legislators. We've had a lot of bills to talk about this year. A lot has been focused on employment work, and not so much on Medicaid funding yet, because they're still working on the budget, and we haven't seen that yet. But we know that if what comes down from the federal level comes down, that it's going to be cuts to our Medicaid budget here. So again, ask questions, ask questions about specific bills. We have a lot more detail in our newsletters online. And that you can make specific notes about to them and attend their forums. It's important for you to show up and be seen. There was a huge crowd at the Capitol yesterday of community providers and their clients and lots of advocates, and everybody was wearing a sticker that said, "I love Medicaid." And it made a huge impact. The visuals make a huge impact, and just showing that you care enough to go up to the Capitol and talk to people or show up at their forums and ask questions is really important to make your presence known. So I encourage you to do that, and we're here to help you. If you need that help, so call us if we can be of help with that.
So we have
And
about,
we have, I think, our list of resources next. Sorry, Amy.
no, we have 4 minutes left. So I just wanted to make sure if anybody had any quick questions, you can put them in the chat. We can try to answer them as well. But I don't know that, Elizabeth, that you need to have a specific House or Senate resolution number for this. It's pretty top of mind to all of our elected officials. So I think if you just reference, either the Department of Education changes, the HHS changes, the Medicaid changes, and demand that they get answers for the questions that we have. I think that can be a good ask. Any other quick questions? I know half an hour does go so fast. I will get those links to the study that, an analysis, the economic analysis that Carlin referenced and put into the slides before I post them. So they'll be up later today, on our website, with all the live links. We will also have all of this in our written newsletter this weekend, that comes out on Monday morning. And yes, there is a protest from 3 to 6 at the Capitol planned today. Is that right? Okay, yes, today. And yes, this recording will be done. It takes a while for it to upload and process, so I think we usually get that out by Monday morning. Is that correct? Yes, Brooke's nodding yes. Just check the website. As soon as I get it, I put the link on where I have the slides as well. So I want to thank our interpreter. We talked so fast today. I don't know how her hands kept up. Thank you. Last questions. All right, well, we got 2 minutes, so I'm gonna hang in here and see if anybody has anything they want to ask real quickly. I know it's a lot. Talk to others. Show up. I wish I should have put the picture of that Grassley town hall where people were packed in with signs, and it was wild. Sorry, Carlin, I cut you off.
I was just hoping that you could briefly explain within the work requirement bill what they're saying and what they mean when they built language in there that would not allow Democrats to like remove the work requirements if they were to gain power. Is that what I'm understanding? Like, so if there's a new administration, if there's a new leadership within the House, that the work requirement language cannot be undone without undoing the Medicaid expansion.
Yeah, Ben, you're talking about the state work requirement bill. And yes, there is, they call it a trigger language. It ends the entire expansion population, which we call the health and wellness plan. It ends the entire thing if the federal government ever says we can't do it. And that has been a problem. Our entire expansion plan does have language that says if the federal government ever significantly changes it, we can decide not to offer it anymore. But this is very specific to the work requirements. So yeah, we would have to change that at the state level, if there were ever a change in the federal administration. One of the things I had asked for originally was, could they say if the costs to administer work requirements ever exceeded the savings, they would stop doing it, but they didn't do that either. So, but that is a concern, and people brought it up, and there was an amendment and it didn't pass. So, yeah. That I think is probably the worst part of the bill, personally, in my opinion.
Thank you.
Well, thanks, everybody. Have a great weekend. And it's almost April. Good to see you, everybody. Bye.
Thanks, everybody.